Lauren. I'm going to be your student nurse today. We're doing the musculoskeletal assessment. Is that correct?
Yep.
Okay, so first I'm going to inspect your spinous process. So I'm going to have you stand up. And then I'm going to have you bend over and touch your toes. And I'm going to lift your shirt up. So I would note that her spinous process is straight with no curvature, which would assess for scoliosis. Okay, you can stand back up. So next we're going to do flexion, extension, and hyperextension of the back. So flexion, extension, and then hyperextension. Flexion, extension, and then hyperextension. Next we're going to do lateral bending. So I'm going to have you lean to your left and then lean to your right. And then rotation. So I'm just going to have you rotate your upper body. So I would note that the patient has full range of motion in her back. So next we're going to test resistance and range of motion in your shoulders, arms, and hands. So I'm going to have you elevate and then depress your shoulders. Elevate and depress. And then I'm going to add resistance. Elevate and depress. Next we're going to do circumduction. So I'm going to have you move your arms in a circular motion, forward and then backwards. And then I'm going to add resistance, so you're going to put your arms out and push forward and then backward. So push forward and then backward. Okay. Next we're going to do adduction and abduction. So abduction and adduction. Abduction and adduction. And then adding resistance. Next we're going to do internal and external rotation. So for internal rotation, I'm going to have you place your hands like this, like you're scratching your back. And then external would be like you're washing your hair. Yep, and then external. And then I'm going to add resistance. Good. Next we're going to do flexion and extension of the shoulders. So for flexion, I'm going to have you lift your arms up. And then extension back, flexion and extension, and then I'm going to add resistance, so flexion, extension. You gotta go back. Good. Okay, so then supination and pronation, supination, pronation, supination, pronation, supination, pronation. And then I'm going to add resistance, so go like this, and flip your hands over. Good. And flip them back. Okay, so for shoulders, arms, and hands, I would note that the patient has full range of motion and her strength is equal bilaterally. So next I'm going to assess your upper extremity, so I'm going to have you sit down. Okay, so I would note that her shoulders, her elbows, her wrists, and her fingers are equal on both sides. I don't note any redness or swelling, any inflammation in her arms. So I'm going to test muscle strength of your lower extremity, so I'm going to have you lay down. So first we're going to do adduction and abduction of the legs. So abduction is bringing it out, adduction, bringing it in. And then other leg. So I'm going to add resistance, so abduction, adduction, abduction, adduction. Next we're going to do flexion of the hips and the knees. So for flexion of the hip, I'm going to have you bring your leg up. And then to flex the knee, point your knee down. There you go. And then same for the other leg. And then I'm going to add resistance. So flexion of the hip, flexion of the knee, flexion of the hip, and flexion of the knee. Next we're going to do internal and external rotation. So I'm going to have you bring your leg up and then rotate it externally and then back in. And then other leg. And then I'm going to do resistance. So I'm going to have you push it out. Good. And then up. Okay, so next we're going to do dorsal flexion and plantar flexion. For this, I would apply gloves and do hand hygiene. So for dorsiflexion, I'm going to have you point your toes towards you and plantar away from you. Good. And then I'm going to add resistance. Good. Next, we're going to do inversion and eversion. So inversion, they're going to face towards the middle, and then eversion away. Good. And then inversion, and then eversion. And then I'm going to have you flex and straighten your toes. So to flex, I'm going to have you curl your toes and then straighten them straight up. And then curl your toes and then straighten them. Okay, now I would take my gloves off and wash my hands again. So I would note that my patient's hips, knees, and feet have full range of motion with equal strength. This concludes your musculoskeletal assessment. I would assure you that the information is kept confidential. Do you have any questions?
Nope.
Okay, thank you for coming in.